Yes.
Okay.
Right. So if you've read and understood considering your surgical pathology station, please tell me what do you understand by the term diverticulitis with endometriosis?
Diverticulitis, inflammation of diverticular. Diverticular is it's multiple pouch in colon due to increased it may be congenital or acquired.
Okay.
Acquired due to increase in intramural pressure due
Right.
to constipation and pushing out waking point due to aging and the chronic constipation.
Okay. Right.
Endometriosis is ectopic endometrium of uterus in endometrial of uterus in ectopic sites like in colon or lung or bone.
All right. Good. Please tell me what are the complications that you can look out for if you don't get to manage this patient on time?
Infection,
All
maybe
right.
peritonitis, perforation,
Yeah.
bleeding, or intestinal obstruction.
Yeah. Even could even
Sepsis,
lead to
septic shock,
fistula problem.
fistula, fistula.
Right. How would you diagnose this condition? We could read that this patient's biopsy was taken and report has come, but what are the investigations one can ask for?
Abdominal ultrasound,
Okay.
maybe a chest X-ray, abdomen X-ray, CT abdomen,
And
and what?
full blood count,
Okay,
urine microscopy,
yes,
sigmoidoscopy to add.
yes, signal.
All right. Can you tell me what are the theories which can be established to understand how the endometriosis can get to the colon?
Okay, there is the regurgitation theory,
Yeah,
benign metastasis,
yeah.
metaplastic theory, and uterine stem progeneration.
So, can you
So,
define
okay,
metaplastic theory, please?
metaplastic theory, the endometrium of uterus is directly from celiac epithelium, mesothelium of pelvis and abdomen, from what we say Müllerian duct.
Yeah.
Yeah. So it's
And
embryonic development of the endometrium of uterine outside the uterus.
okay, right. Right. Okay. What I want you to tell me that what is the treatment that can be offered to this patient?
We maybe as a conservative treatment, if there is no complication like peritonitis, we will do fluid and give antibiotic and what else? Conservative treatment.
Yes.
Maybe the range of abscess if there is a collection. Or if there is complication like perforation or fistula, we will go to diverticular colostomy and Hartmann procedure and what? And resection anastomosis.
Okay. Can you please help me and read this image?
Okay. No.
All right. If you'll take an intraperitoneal image, of
Okay.
this patient with diverticulitis with endometriosis,
Mm-hmm.
what do you expect to see?
I will see tissue of endometrium in the hair colon or hair intestine.
Is there anything that you can see here or identify here in these two images that you are
There is
looking at?
difference between right and left photo.
Yeah,
Sure.
and see here something is written gastroenteral.
Okay.
So this is extra, like you were saying, extra uterine kind
Urine
of,
tissue. Yeah.
yes, diverted endometriosis that you are looking at. And
Okay.
that is why you have to compare it with this one, which
Right.
is the uterine. So,
Normal intestine tissue.
yeah. So here, what you see, now that I've told you, are you able to differentiate these two? What kind of, okay, what kind of muscle would this be? You can maybe guess with the nuclei. Uh,
Mm.
maybe no. Okay.
Mm. Mm.
Because of the dye. So there is burnt powder. You could see here dark.
Yes.
Okay. And there is dark blue,
Chocolate cyst.
black chocolate cyst.
Cyst.
Yes.
Mm.
So here you could also see the cysts, but here it is one.
Okay.
Right. So this is one. Please tell me, how would you define or how would you classify diverticulum?
Hinge classification.
Okay, please tell me.
It's four classification.
Yes.
One is in pericolic abscess. Two
Paracolic, yes. Localized.
paracolic,
Yes.
yeah,
Yeah.
localized, and two classified to A and B. A is distant abscess with unable to percutaneous drainage. B is complex abscess that don't able to skin drainage. Four is peritonitis and لا three
With
peritonitis,
perforation.
perforation and peritonitis and virulent peritonitis, and
Yes.
four fecal peritonitis.
Yeah, four is fecal.
Mhm.
Four is actually with the
Fistula,
perforation.
yes.
Yes, yes, yes. Okay. Right. Please tell me that this patient, you have managed this patient with Hartmann's procedure, and now patient visits you after few days, and patient has developed pain in the left iliac fossa and comes to you with the pain. And how would you, or what would you explain to this same patient?
It's maybe leakage from the site of surgery. It's
Okay.
maybe a pelvic abscess collection
Yeah.
or peritonitis.
Yeah.
Maybe
Good.
peritonitis.
Yeah.
Uh,
So, what would be your next step of
it's
management?
management as a CRISP protocol.
Yeah,
First, ABC, airway and the breathing.
yeah,
Maybe she had to put in oxygen. Two is give a fluid,
okay.
and if
And
needed,
then
will maybe do peritoneal lavage to
yes,
uh,
exploratory laparotomy
breathe.
soilage. Yes, all right. What medications, antibiotics can be given in the patients with these?
Okay, we will give amoxiclav for gram positive,
Yes,
1.2 gram per day for
yeah,
7 days.
yeah,
Gentamicin 80 milligram per day for 3 days to gram negative bacteria.
yeah.
And clindamycin for anaerobic bacteria 600 milligram per day for 5 days.
Okay. Last question, please.
Okay.
Right. This patient, all right, you've discovered that she has also endometriosis.
Mm.
What would you be extra conscious about, or what would you?
Maybe risk for cancer,
Very good.
ovarian cancer
Yes, very good.
increase.
Yes,
Okay.
excellent.
Thank you.
Well done.